Okay, so I'm going to talk about fluid balance in this video. When you're studying fluid and electrolytes and acid base, there's three topics you need to really have a grasp on. The first one is fluid balance, all things fluid balance, which I'm going to cover in this video. I plan to make a separate video that is just focusing on the electrolytes. And then there'll be a third video with the acid base balance. I may or may not make one because I think the simple nursing video that I posted is fantastic, and I don't know that I can do any better than that. So I may or may not, I don't know. But I'm definitely going to cover fluid balance and electrolytes, even though there are supplemental videos that I posted that are really good. But anyway, so let's talk about fluid balance. And so the outline for this lecture, if you want to follow along, is the study guide, the Simple Nursing Study Guide. I think that's probably going to be how I do every lecture, is I'll take the Simple Nursing Study Guide and I kind of follow that format and just maybe I kind of unpack it a little bit for you. And we kind of use this as a discussion piece because those Simple Nursing Study Guides, they cover all the big things, the things that you have to know. And if you know those things really well about whatever topic it is, you're gonna be in good shape. So okay, so let's get started with fluid balance. So first off, there's three types of fluid. There's isotonic, hypotonic, and hypertonic. So let's start there. Let's start the conversation there. I'm gonna have to move because I am right-handed and I was on the left side. It just wasn't working. Let's see how this works. Okay. Hypo, iso, and high. I don't know why I did that. We'll say hyper. Okay. Let's talk about what these words mean. So first of all, hypo means below. Iso means the same. Hyper means too much. I'm speaking in layman terms here. Okay, so as it says in the study guide, it spells it out. So it talks about isotonic. Isotonic solution means that it has got the perfect amount of concentration of fluid and solutes. Okay, let's talk about some terminology here. Solutes is a term that we use for the things inside the fluid. So if you could imagine making some lemonade, and you take lemonade and you put water in, and then you put sugar in it, and you put the country time lemonade mix or whatever you use to make lemonade. So the contents that you put inside the water is kind of like your solutes. And so when we talk about in fluid electrolytes, the various particles that are inside the plasma or inside the vascular space, the stuff that makes up the concentration, that's solute. So if you hear that word, that's what we're talking about. It's the amount of concentration. So iso means you've got a perfect balance, which is good. And that's the whole goal of fluid and electrolytes, acid base, is keeping balance, right? Our body has to have the right amount of these things to make our body do what it needs to do. So isotonic, as it says, is iso perfect. So it's the same. So isotonic is same. Hypo is below, means that it's diluted, right? It doesn't have enough of the particles or the solutes inside it. Hyper means above. So it has above enough. It has too much solutes, or it's concentrated. So you could think of about it like it's concentrated, and you could even think diluted with hypo, right? And then it is we'll say just right. Okay? So we got some terminology out of the way. And that's the first thing he's got listed here is isotonic fluid. It says iso perfect, so it's perfect balance. And so now we're going to talk about why that's important. So you have cells in your body, right? And your cells are made up of largely fluid, right? So 60 to 70% of your body is fluid. And it is very important that we have a good fluid balance. So our cells look something like this. Okay, this is an isotonic cell. Okay, there's a cell, and then you've got things on the inside of the cell. We'll talk about what's inside the cell, like move that a little closer later, maybe more so in the electrolyte portion, but just envision this. This is an isotonic cell. It's got just the right amount of stuff. Hypo cell is going to be bigger. And the reason it's bigger is because it's got more fluid in it. And it might have the same amount of solutes, but it's got more fluid, therefore it's more diluted. So hypo, and he says it here, but think hippo. Hypotonic cells are swollen, so they're bigger. So they're not going to have enough fluid or enough solutes to match the amount of fluid. Hypertonic, they're going to be small. And they're going to be really concentrated. So the fluid has shifted. And so when you give an isotonic fluid, that fluid doesn't shift. If you give someone a hypotonic fluid, what's going to happen is the solutes inside the cell are going to move outside the cell, but to try and make a fluid balance in the hypotonic solution. And the solution is actually going to come into the cell if it's a hypertonic. If you give a hypotonic solution, it means it's a diluted type fluid, that it's going to cause the cells to swell because they're going to get more water inside the cells. It's going to cause a fluid shift. Hypertonics causes cells to shrink. So a hypertonic solution, you get this fluid coming with a lot of concentration going in. It's going to pull fluid out of that cell, which is going to cause that cell to shrink, and it's because it's trying to compensate for that hypertonic solution that's coming in. Whereas a hypotonic, the fluid's going to go in there and it's going to cross that cell membrane and try to dilute the stuff that's on the inside of the cell. And that's, in a nutshell, that's what those three are. Here are the actual types of fluids that we'll talk about, and you'll need to know. So there's two main fluids that are isotonic, and there's 0.9% normal saline and LR. That's lactated ringers. Those, and actually D5W is one too. So that's dextrose, 5% in water. Lactated ringers is LR, 0.9% normal saline. Those are your three big dogs that are isotonic. Okay, we give isotonic solutions most of the time because they don't cause a fluid shift. That's why you see them most often in the hospital. Those are primarily used to replace volume. If someone is dehydrated, we want to add fluid, we want to add volume to them, but we don't want to jack up their electrolytes. We don't want to cause a sodium imbalance because sodium is kind of the main player that's inside these fluids. And so if we were to fill them up with a hypotonic solution, well, then you're going to give them a lot of fluid and not enough sodium to go with it. So you'll cause hyponatremia, which we'll talk about that in another video. And if you give them a hypertonic solution, it's going to cause them to be. It's going to cause the fluid inside their body to be hypertonic, and we don't want that. We want them to be isotonic. So we give the isotonic fluids to replace volume. Now, the risk that we run, there's a risk with all of these that we give. So if we give this fluid, if we give this type or this type, we are worried about fluid shift. This one, we're worried about giving them too much and causing fluid volume overload. And we're going to talk about fluid volume overload here in just a quick second. But your 3% normal saline is pretty much the only one you'll see that you'll probably hear us talk about, and that's the hypertonic solution. That's always given in the ICU because there is a huge risk of causing swelling on the brain. It causes fluid shift. It is really dangerous and has to be monitored closely. So and then 0.45% normal saline is your most common hypotonic solution. Let's see if they mention any more of those. Yeah, I mean any percentage below. So think ground zero or like breaking even is 0.9%. So any percentage below that is going to be hypotonic. Anything above that is going to be hypertonic. But this is your main ones. If you know these, you're in good shape. But if, for instance, if you've seen 0.225%, you know that's hypotonic, right? And your big concern is cellular swelling. So that's a good overview of those fluids. So now that we've talked about the types of fluids, let's move on to the next page. Let's talk about our first. We're going to talk about there's two major conditions that we're really worried about in this portion of fluid electrolytes that we're studying, right? It's fluid volume deficit, fluid volume overload. Just to make it real simple, it's too much fluid in the body or too little. And we've got to know what that looks like and why is it dangerous? How do we treat it? You know that, you're in good shape. So I'm going to erase this and we're going to get into those two. Okay. So first up is fluid volume deficit or dehydration. Okay, so fluid volume deficit is a common manifestation of dehydration. You have a decreased amount of fluid. It says here they're dried up like a raisin. So dry, dehydration, deficit of fluid. Okay, so let's think about let's think about what causes this first of all. Someone could be diuresing too much. They could be peeing too much. Maybe they've taken a medicine called a diuretic, Lasix, furosemide, that type of medicine. I don't know what y'all know about these medicines yet. You may have already talked about them. I'm not sure. I'm sure you've probably at least heard of them by now. But anyway, if there's something in their body, if there's something that causes them to urinate excessively, they could lose fluid that way. They could sweat a whole lot because our integumentary system plays a major role in regulating fluid balance. We sweat, and we also hold on to fluid through our skin and our tissues and things like that. So sweating, peeing too much, vomiting, having diarrhea, you lose fluid all those ways. If there was some kind of compromise in the integumentary system, burns is a big one. If we have burn, we've destroyed our skin, and therefore we're at a really high risk for losing fluid and being dehydrated or having a fluid volume deficit. Another fun fact is muscle. So our muscles are mostly made up of fluid. So people with a higher muscle mass have more fluid, whereas more obese people that have a higher amount of fat, they're actually more at risk for dehydration than people that are mostly muscle. And so you think our elderly people, when you get older, you lose muscle mass, so that makes them at a high risk for fluid volume deficit, or infants, babies. They're at a high risk for fluid volume deficit. And it's due to the lack of muscle mass. Or people that are morbidly obese, because fat repels water, and less muscle means less fluid. So that's kind of the things that cause it. Now let's talk about what it looks like. Well, they're probably going to be. So I'm going to look at. So let's see, fluid volume deficit. Signs and symptoms. They might be thirsty. The body's trying to compensate. There's a glare. I don't know how to get rid of that. But anyway, mostly anything I'm writing on this board is most likely in here in this study guide, so it's not a huge deal. Their urine will be concentrated. Okay, so your kidneys, they function like filters. You'll hear in simple nursing, you'll hear them call them washing machines. And basically fluid runs through the kidneys, it filters. It's called filtration. I think there's actually 3 methods of which we lose fluid. We'll talk about those: osmosis, filtration, and diffusion. Don't want to complicate it. Don't want to make it sound more intelligent or harder than it has to be. But that's what your kidneys do. They filter water. Well, your kidneys will try to compensate for a fluid imbalance. If you've got too little fluid, when you go to urinate, the urine will be more concentrated, so it'll have a higher volume or a higher amount of solutes in your urine, and it'll be really just kind of dark and kind of, you ain't trying to be gross, it'll be kind of sticky and that kind of stuff. So generally speaking, lab work, which we're not going to talk. Well, yeah, we will talk a little bit about lab work in this section. Your labs, for the most part, when you're dehydrated, are going to be elevated because your serum, your blood, is going to be concentrated because there's not enough fluid to dilute that stuff. So just kind of keep that in mind. But you'll be holding on, so you may not be urinating as much. So I'll put decreased urination. Oh yeah, and then this is your heart rate is going to go up. Let's think about that for a minute. The goal of the heart's a pump, right? And the heart pumps blood to perfuse all of our organs. Well, we don't have enough volume to get to all those organs. The heart rate's got to work harder. So your heart rate's going to be elevated. Your blood pressure is usually going to be lower because there's not enough, your veins are not as full. So my side job is I am an infusion nurse, and my job with that job is I go out to homes and I'll start IVs on all different types of people, and I give them various medications. And I see this very much a lot of times, and it makes sense. But anyway, you get what I'm saying. People that are dehydrated are really, really, really hard to get an IV on because there's not enough volume in their veins. And you can't try to find a vein, they're not palpable, so I'll have to encourage them, hey, drink fluid, and then it's crazy. They'll drink a couple glasses of water, you'll be able to see a vein, and then you're good to go. But the veins are just not as full, so you have low blood pressure and dehydration. Okay, I am going, and then let's talk about, so that's what it looks like. How do we fix it? We'll just talk about, we'll use the word intervention. Interventions. Okay, number 1, replace with isotonic fluid, usually 0.9% saline or LR. I don't know that I covered this word either. We talked about terminology. So ISO and then tonic. So tonic refers to a word called tonicity, and that is just simply a word to describe the concentration in the fluid, in your blood, in your vascular space, whatever we're talking about. When we say, it's isotonic, so it's iso means it's the same as a good balance of tonicity. Hypotonic means that it's low concentrated, and hyper means it's highly concentrated. So that's what tonic means, or tonicity. That's what that is. Okay. So we're going to replace it. We might want to fix whatever's causing. Okay, so up here on causes, let's say it was caused by vomiting or diarrhea. Vomiting or diarrhea, and I may have misspelled diarrhea, but you want to fix this. So fix whatever's causing that. So in a nutshell, you replace the fluids, and if there's a reason behind why they lost the fluids, you'll fix that. You'll treat that. So you might give them medication to slow down the diarrhea. You might give them medication to make them stop vomiting or whatnot. But for the sake of this lecture, you need to know, okay, you're going to be given a scenario. Patient's got low blood pressure. Patient's got elevated sodium. All the patient's lab work is elevated, but their blood pressure is down. Fluid volume deficit, you might want to give them some volume, right? Heart rate's up. Be on the lookout for this. This right here is the big boy in this. Knowing the signs and symptoms of this, the intervention is pretty simple. You just basically give them fluid. I mean, you might could fix their whatever's causing it, but for the most part, you want to give them isotonic solution. You know this should be in pretty good shape with fluid volume deficit. So it does talk about top reasons, and understand that these simple nursing things are intended to be given to students that are finished with nursing, for the most part. That ain't always true. Are preparing for the NCLEX, like they've graduated, and so some of this stuff is going to cover things that we're probably not going to cover. So it says diabetes insipidus. We're not going to talk about diabetes insipidus this semester in class. I can tell you what it is real quick. Diabetes insipidus has nothing to do with diabetes like your blood sugar. Diabetes insipidus is where you have too little antidiuretic hormone, and you just pee. You just do a whole bunch of peeing. That's in a nutshell what diabetes insipidus is. DKA, diabetic ketoacidosis. We won't really talk about that either. But what that is when your blood sugar gets so dang high and your body's doesn't have any in insulin. Well, you haven't even talked about diabetes yet, so it doesn't make sense. It's a condition that we won't talk about till later, probably like another semester or two from now. But just know that one of the side effects or one of the symptoms of it is frequent urination, and that's why. And then diuretics, and it lists some diuretic medication. But the big one that you're going to need to know is diuretics, and then the stuff I talked about, vomiting, diarrhea, stuff like that. So I feel like we've covered fluid volume deficit pretty good. Let's look at fluid volume overload. Okay. Fluid volume overload. So it's just like the name says. So let's talk about what would cause fluid volume overload. So we have too much fluid. What causes it? Bunch of things. Simply too much isotonic fluid of whatever kind. So fluid volume FVO, fluid volume overload causes. Okay. Heart failure. I don't know that we're going to, I mean, we will talk about heart failure probably sometime in March, but with your heart, if your heart's not pumping adequately, fluid starts backing up. So heart failure could cause it. Big one, kidney failure. Kidney failure. Kidneys are not functioning properly, and you're holding on to too much fluid. See if he mentions anything of what causes it that I'm not thinking about. That's kind of it. I mean, there may be some more, but if you know these, just think in terms of anything that could cause you to hold on to fluid. But these are the big. Okay, yeah. So that's kind of tricky though. You could consume a lot of salt. We'll say too much salty foods. They'll cause swelling because water follows salt, water follows sodium. That could cause it. Okay. And we're going to talk about that when we get to talk about electrolytes, but right now we're just focusing on fluids. Okay. So what does it look like? Signs and symptoms. They're going to have some edema. He gives good pictures on this. You see and I know you can't see it in this, but if you're looking at yours, the guy's he's got a picture of a guy and his whole body's just full of fluid on the inside. So the inside, he's kind of like a balloon. He's like swollen up, and it's a whole bunch of fluid. So you have edema, might be pitting. Their skin is going to be pale and cool. All right, because so you've got fluid in your cells and in your vascular space. So that's the inside the cell and outside the cell. That's your two main components or compartments where fluid is. But sometimes you have fluid at third spaces, and third space is just like, it's not in either one. It's just kind of out there, and it's just like it's not necessarily in the vein. It's sort of in the tissue, and it's just kind of puffing up. And so when you go and you do an assessment and you see you kind of press down and it don't really bounce back up, it's pitting. That could be and it makes their extremity or wherever it was, it's kind of cool, pale. I have a color to it, so you might see that. They could have a headache. So. Also know that they could have all the things that are associated with hyponatremia, which is a low sodium. I ain't going to talk too much about that because that's going to be in the electrolyte part. But anyway, so just know generally their labs are going to be low. The guy in Simple Nursing calls them low liquidy labs. So just like I said, the person that's got fluid volume deficit or dehydrated, their labs are going to be high and dry. They're going to be elevated because they're concentrated. Well, the labs are going to be diluted. So the number is going to be low because there's more fluid and the concentrates inside of it are going to be a smaller amount of them compared to the amount of fluid. So their lab work could be diluted. Not always. That's a kind of a tricky one, but as a general rule, low liquidy labs when you are swollen up with fluid. And he even uses that term in this thing. Um, so let's talk about weight gain. Weight gain, huge, 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 huge. Can't stress enough. Weight gain. 100% know about weight gain with weight gain greater than 2 to 3 pounds in a day or 5 pounds in a week is like the hallmark way to monitor fluid. You want to teach, if you ever, I ain't gonna say that because I don't know, I might mess you up. Something to really consider is if you're being asked a question about an intervention, about a patient to prevent um, fluid overload, teach them to weigh themselves daily. At the same time every day, wearing the same type of clothing. And that's the best indicator is daily weights. So you want to teach them, that's it. So look for weight gain. They could have, they're gonna have, they might have frequent urination because the body's trying to compensate and trying to get rid of that fluid, or they may have a decrease in urination because the kidneys aren't working and that's why they have fluid overload in the first place. It just really that could vary. You kind of have to look at the whole picture. But you know what? Like if you're given a scenario, it's going to tell you more than just this. It's going to give you other cues to let you know which way to go with it. So you kind of got to know like the bigger picture. With that, we'll give you, or the NCLEX or whatever test you're taking is going to give you a little bit more cues than just one isolated thing. But that, in a nutshell, that's what causes it. That's what it looks like. What do we do to treat it? Well, interventions. The main one, you want them to diurese. Give diuretics. Teach low sodium diet. Remember, because I said salt causes you to hold on to fluid. Absolutely daily weights and daily weights. If I mean, I don't know that it's good to know this. I don't know that we'll cover this, but if they're on dialysis, so their kidneys, if their kidneys aren't working, we might give them dialysis, which is basically a machine that we hook them up to that filters, that functions as their kidneys because their kidneys ain't working for them and helps remove the fluid like their kidneys would. Those are the big ones. Oh yeah, no, I forgot another one. Fluid restriction, huge. We want to teach them fluid restrictions and strict. This is a good one. Strict I's and O's. We need to really monitor, keep up with the amount of fluid that's going in and the fluid that's going out. Those are your big interventions. I may have forgotten a thing or two. Please do watch the fluid balance video that I posted, the supplemental video. I think it's by Nurse Sarah. Watch that. Watch this. Study your study guide. If you can take the study guide and really own this, like not just memorize it, but understand it, be able to articulate it. Something doesn't make sense, a concept that it lists doesn't make sense, understand it, come find me, reach out to me, ask me. look up other YouTube videos or something and try to understand it. But if you really know this study guide and kind of smell what it's stepping in, you'll be fine. All right, well, that does it for fluid balance. And yeah, that does it for fluid balance. I'll make another video about the other stuff.